Radio Free 102.3 KJLH. Good morning. I'm Dominique DiPrima. As I'm walking to the mic, I'm asking for blessings from God Almighty, the ancestors, the righteous elders, and Southern California's early morning, not so early morning, town hall edition of the Front Page is now wide open. Welcome, family. Such an honor to be here and so happy to be able to respond to you because we are you in the midst of this crisis. Today's show is brought to you by the Independent Professionals Association at indiework.org, the City of Los Angeles, Community Build, and Council President Emeritus Herb Wesson. Today's topic, we are focusing on COVID-19, the black impact, lots of rumors as with everything associated with all day long. 520-KJLH, 520-5554. Just add your area code of 310 and 818-562 and you'll get right in. Joining us this morning, he served as president of the LA City Council from 2011 through 2019, representing Council District 10 since 2005, the first African-American ever to hold the position of council president in the city's history. I am talking about Council President Emeritus Herb J. Wesson Jr. Welcome to the show.
It's a pleasure to be with you, and I really enjoy listening, and I'm glad I could participate.
Well, and we are ever thankful that you have helped make this possible. Really something that people are responding well to, and so we feel like we're filling a need.
Well, knowledge is power, and you guys have done a phenomenal job, so I have to thank you. I've got to thank the station. I've got to thank Mr. Wonder. This has been great, I think, for our community and all of the listeners.
Councilmember Wesson, I know that our topic today is about the black impact of COVID-19. Of course, at first the rumor was black people couldn't get it at all. Now we see that's definitely not true. But you were one of the first people that I heard of in our region calling for specific numbers on how this was impacting the African-American community. What made you think to do that?
Well, I mean, you kind of touched on it. There were all of these rumors out there, primarily on social media, that suggested that people of color and black people couldn't even get this. Okay, and then you recognize that historically we have been a group of people that haven't had proper health care. We deal with a broken public health care system. We also began to hear information from other parts of the country where the statistics would show the exact opposite, where African Americans and people of color were dying at a higher rate. So I sent a letter to the county of LA requesting that we get this information broken down racially, because this data, not only will it help us as a people understand that, hey, you can get this, take care of yourself, take care of your family, take care of your loved ones, but it's data like this that should guide where you place the resources. And that's why I felt that it was so important, and I'm glad that I did, because this conversation that we're having today, is happening throughout this entire region and the country.
And, and honestly, it sounds like it's just the same thing in a weird way as the census, where if we don't know where the people are, we don't know where the resources are meant to go, and then we miss out on the solution, which is oftentimes those very resources.
No, I agree with that, and that's why in order to deal with this virus, we've got to have, the data, the information, and it is really alarming, maybe not shocking, but it definitely opens eyes when you look at places like Chicago, where less than a third of the individuals are African American, but yet 70% of the deaths plus are African Americans, and you can basically, go to other major cities in some states like Louisiana. The death rate of African Americans was approximately 70%. In Michigan, I think the population is 14% African American, but the deaths are over 40. So these statistics should, without hesitation, guide where we place the resources.
We're being joined right now by another important person in the city of Los Angeles. She got her bachelor's degree in psychology and master's degree in gerontology and public administration from USC. She's an expert in her field. She's been a frequent speaker and consultant nationally and internationally on issues related to the elderly and aging. She's a general manager of the City of Los Angeles Department of Aging. Laura Trejo, good morning.
Good morning, Dominique. It's a pleasure to be here.
Thanks for giving up your Saturday. I know you're busy.
Anytime.
She's a hard worker and a good person.
No doubt. Well, you talk about Department of Aging, and I'm saying, oh, well, this show is focused on, the Black impact. But really, when we look at COVID-19, we're looking at all across the board. Our concerns have to be first and foremost focused on people over 65, right?
Absolutely. Older adults are one of the high-risk populations, not only as a result of their age and potential frailties that they experience associated with normal aging, but also because they're disproportionately represented among people with high-risk conditions like diabetes, hypertension, and other types of conditions that may make them more vulnerable to the COVID-19. In addition to that, I think in communities of color, African American and Latinos in particular, we have not had access to the types of resources that we've needed throughout our lifespan. So we have older adults that are even more at risk. And so we want to make sure that we're reaching out to them and that we're providing the supports and services that they need.
So you're talking about a lifetime of less access to the kinds of medical, resources that make us stronger at the end of our life, right, of having had treatment. So if you have these untreated conditions, then you're more likely to be vulnerable to something like COVID-19. Is that kind of in a nutshell what you're saying?
In a nutshell, it is. Basically, we are the sum of all of our life experiences. And so if we have had less access to education, economic resources, all kinds of things in our lives, they add up over time. And so when we get to be older adults, we become less likely to be able to be in a very strong state of health. And so that is important in communities of color like ours, because we want to make sure that we're reaching out to people with the right resources that they need in order to stay well and safe.
So, Councilmember Wesson, you fast forward to you get these numbers and you said, yeah, okay, this can guide where these resources should go. But, for me, reporting every day on the news, I'm actually pleasantly surprised, even though I know the need is overwhelming, at how quickly the city is acting in some regards and how innovative in some ways the city and the state have been in responding to this crisis. Can you talk a little bit about the response, once you start seeing these numbers?
Well, the city, I'm proud to be a representative of this city, and we determined quite a while ago that we were going to try to respond to all of the needs of the people within this great city of Los Angeles. So the elected officials here have acted quickly, have worked together well in a way that I haven't seen before. So that makes me really feel optimistic about the future. And I would have to suggest that the reasons why our numbers are different from other parts of the country is because of the actions of the governor, the mayor, the legislature, the local governments, the county of LA, Supervisor, Ridley Thomas, and all of us working together and trying to get in front of this. But I think that for me, it is important, number one, that we tell people of color, African Americans and Latinos in particular, that yes, you can get this. Protect yourself, follow the guidelines. I also think that it's important as we're trying to put together resources for our community that we also take advantage of this moment when all eyes are on this virus based on a lot of the information that Laura said. We need to change this broken public health care system and ensure that it provides resources to all in need. The color of your skin or your zip code should not dictate your lifespan.
Mm-hmm. Absolutely. And we have a bunch of people already calling, which I love, because I love the idea that we can use these town hall style segments to really give people access to the information that they need. Before we go to the calls, though, Laura Trejo, I got to ask you, there's a lot of seniors in our community, African American, mm-hmm. and I imagine Latino community too, that are actually primary caregivers for little kids, or they're, they're the daycare while the parents
mm-hmm.
go to work. And so in a situation like COVID where little kids are less likely to get it, although we now know that they can, and we've seen some children dying, but they're more likely to carry it home and make the elder family member sick. What kind of resources or support can be put in place for that? And also, if you would talk just a little bit about some of the great things that are happening as far as these meals for seniors and supports for seniors who are often home alone.
Thank you for the opportunity. Definitely, I think families need to really think through if they have a vulnerable elder in the house, to follow basic precautions also in terms of making sure that they're washing their hands, that they really adhere to the guidance that is being provided to all of us in terms of the ability to not transmit it, because I know the children are moving about, but also understanding where children have been, and before they walk in the house, making sure that their hands are washed so that if grandma's there, they're just not going to run and hug her and potentially put her at risk. So our families really need to follow basic guidelines, even in the household. In terms of the work of the Department of Aging, I am extremely proud of a team and a community that has really come together to provide supports and services to older people. While all of our community sites are closed because of the guidance, I can tell you everybody is hard at work and available to provide services and support. We have transitioned all of our delivery meal programs, all of our meals programs to home delivery, so nobody has to worry about that. If seniors in the community or their families are interested, and they really don't know what they need, I encourage them to call 211. If they actually do know that they want only a meal, they're welcome to call the Department of Aging at 213-482-7252. And also we have the mayor's line for the Senior Emergency Meal Program, and that is 213-263-5226. And I'll make sure that the station has the number in case folks call you later. But always reach out to us first so that we can tell you what services are available. This is a very dynamic situation, and I can tell you almost on a daily basis, we're launching a new program based on the needs that the community identifies for us. So we're transitioning almost all of our programs to telephone, to online, and to other mediums so that we have access to older adults. But this is happening almost on a daily basis. We have a very robust relationship with LA County, and together we're trying to figure out how to launch programs that are regionally accessible to all communities. So the first best place to start is call 211 for the more general questions, and then if you live in the city of Los Angeles, you're always welcome to call the Department of Aging.
Excellent. We are talking with Councilmember Herb Wesson Jr. and General Manager Laura Trejo of the Department of Aging. We're taking your phone calls, 520-KJLH, 520-5554. It is the front page Saturday Town Hall edition, and we are going to go to Desiree calling us from Los Angeles. Good morning, Desiree.
Good morning, Dominique. Good morning, council member and Miss Laura Trejo.
Trejo, yeah, close. Close.
Trejo. I'm grateful that you have this program. I give thanks to the Most High and to Mr. Stephen Morris for his station, KJLH. And I'm concerned about the unhoused elder people and how they are going to get whatever benefits are being handed down. And I'm also concerned about the fact that how are they washing their hands? How are they charging their phones? How are they able to stay healthy during this time when all of the 24-hour fitnesses are closed, the health clubs are closed, and there just aren't enough places for the unhoused, especially as seniors.
Okay, let's allow the folks to answer. Okay, Desiree, I think you made several really salient points here. Who wants to go first, talking about the homeless and this COVID crisis and just the resources?
Well, she kind of went in and out, but I think I got the gist of what she was saying. I mean, this issue has really highlighted, the challenges that we have as a city to help our unhoused people. So some of the things that we are doing is we are creating rec and park centers into actual shelters where the homeless individuals can come and stay. We are working with the state and the county to acquire trailers where individuals are being placed in trailers. I know that this week I just agreed to take another 60 trailers that we're trying to figure out where we're going to place these people. We are working, the governor and the city and the county are negotiating with motel and hotel owners throughout the state to make rooms available for our homeless community. And every day as we're beginning to try to plan how to address this, we always factor in creative ways in which we can provide homeless individuals with the services that they need.
Laura Trejo, you want to address that? I mean, and as it was going in and out a bit, she was basically asking, about the hand washing, about, the ability for homeless and unhoused people to get clean, to get these meals and other resources that are being offered for elderly people during this time.
Absolutely, and I support everything that Councilmember Wesson just said. In addition to that, I can tell you that I've been working with the city in terms of the shelters that they're providing to make sure that they have the special precautions for older adults, that they understand the unique needs of older persons who are homeless, and they are very aware of the special needs that older homeless adults bring that have to be addressed, and so those are being addressed. And we actually talk on a constant basis so that we're making sure that we're connecting the clients and the participants that they are recruiting into the shelters with the services and supports that they need. So it is a very important thing to all of us. And I also want you to know that the LA County Board of Supervisors has now issued. We're working on very tight deadlines to respond to them specifically on this question of what is the entire region doing to ensure the safety and well-being of older persons who are unsheltered and homeless. So, yeah, very much so. It's very much on our priority. Thank you for asking that question.
And
another
thing, Dominique, is during this time when you're talking about over 50% of the city being out of work at this point, the city of LA and the state and other jurisdictions have put in place very strong tenant protections. because the worst thing that we could do at this point is add to our homeless population. So we are putting in place restrictions where it relates to people getting evicted. And if individuals want information as to how that works, they could go to my website, herbwesson.com, or call one of the council offices if they're having issues with landlords, and we can walk them through this process, because this is not a time where you want to throw anybody out onto the street.
Are we looking at how you can support those mom and pop, mortgage holders that, now, the tenants, can't be evicted, but I'm also concerned about, not the huge chains, but regular people that own property and rent it out, and worry that some of these people of color that are, that hold these mortgages in South LA especially, could also be at risk.
Well, we're putting together funds to rental assistance programs. We're also putting together funds that small business like mom and pops can apply for. The federal government has been working on a series of stimulus packages. And in fact, that brings me to something that's near and dear to my heart. I do believe that there will be more stimulus packages that are voted on by the federal government. And I think we really need to put in place a people's bailout, something that actually protects the people. I support everything that we're doing for the business community, but also we should bail out the people. We should ensure that anybody that needs a job can get a job with a livable wage and health insurance. I think we need to have a conversation about Franklin Delano Roosevelt-esque New Deal that actually takes care of the people. Let us bail out the people.
Excellent. Let's go to Nick from Inglewood. Good morning, Nick.
Good morning, my dear DiPrima, the supervisor, and the lady from the aging department. I want to know how many more of testing centers, because I see a bunch of, I'm not giving no free ad this morning because I'm also a broadcaster. I see a lot of mobile out in our community on Crenshaw and down, in LA. How many more mobile or centers, medical centers, that are setting to test our community? Because I hear, I'm a black person, but I'm from the Caribbean. Yes, my people are black Americans, but what about other cultures that not, I'm not hearing about?
Got it. Well, I know for sure there are at least 30 testing centers right now. We actually have them listed on our website, KJLHradio.com. And I read, Ms. Trejo, that we had a bunch of mobile units that are going out now to help with people that are in nursing homes and elder facilities.
Absolutely. Those were ramped up last week to start visiting the nursing homes in the city of Los Angeles. Excuse me. And so that has been ongoing already because we're highly concerned about the well-being of older persons in nursing facilities as well. So that is occurring already. And so that's in addition to the testing sites that are occurring in the community.
Okay.
And a lot of that goes back to this data, because the data will help dictate where we need to place the resources. That's why all of this is so critically important. But what you see now is government really partnering with nonprofits to try to come up with creative ways to test individuals throughout the region.
All right, we're going to take a break right here. We'll continue with your phone calls, 520-KJLH, 520-5554. That's the number to call. Council Member Herb Wesson, I know you have a busy day, and I thank you for joining us today, and General Manager Trejo as well. What would you leave us with this morning, Council Member Wesson?
At this point, we all just have to help each other. When I leave you today, and I'm going to do this, I'm going to social distance, and I'm going to follow all the guidelines, but we've got to help our own. So I'm getting ready to go to 3 different feeding programs. And you hear people say, well, everybody's talking about, lunch programs and feeding programs. Well, guess what? People have to eat every day. So you just don't feed a person on Monday. They eat every Monday. So it is important that we all come together and we go a little bit above and beyond. And if there's anything that you have, any donations that you'd like to make, trust me, there are people that are in need. We will make it through this together. And I guess the last thing that I will say is that I'm driving around the city and I'm seeing individuals selling these protective masks for $5 and $6. And God bless them for being entrepreneurs. But if anybody that's listening needs a mask, just go to herbwesson.com and we will do the best we can to send you a mask or 2 for free.
Excellent. That's a good tip. Laura Trejo, thank you also for joining. What would you leave us with this morning?
I just want to tell families that we're there for you. Please reach out to us. You are not alone in this. And we're waiting for you to call us and reach out so that we can be of assistance in any way that we can. We welcome your call.
All right. Thanks so much. We'll post that information at KJLHradio.com. We'll be talking with the California Surgeon General. We'll be talking with Dr. Robert K. Ross, Melina Abdullah from Black Lives Matter, and more. Radio Free 102.3 KJLH.